very important, or a number of very important additional topics to what we have discussed so far. And one that really struck me is the element of the need for really research on what patients need, because it is so difficult to say what is the patient. And Jan has already mentioned that the patient as such does not exist, but I think to be able to direct the treatment or to design the treatment in a meaningful way to the individual patient needs, we really have to do more research on that. But before we come to that point, we have now the ethicist, despite the fact that Jozef Glasa is also a clinician, a clinical pharmacologist, and working as a physician on a daily basis, but also teaching in ethics. So if you would like to really use the word ethics, on which we are having here this session formally, and then we go into the debate.
Thank you, Ingrid. Good afternoon to everyone, and I am really happy to see at least some audience here. And I am afraid I am just to bring more questions and more more questions to this already quite complex area that we were being introduced very well by the previous speakers. And well, what is ethics about? It is about just one major question: how to do good and how to avoid evil. And also there are many other questions: what is the good and what is the evil, and so on and so forth. So I am not going to speak too much about ethics as such, or philosophy or theology or so, but I just would like to point out some paradoxes that we encounter in this very, very new field, and a field that is developing very, very much at breathtaking pace. So I try to go like this is depicted in this short overview, and let us to see the first slide. And the question is, are we dealing with hopes or hypes here? And even going through this conference, you have seen a lot of first-class research. But how much it is really connected to clinics, and what would be the real implications and applications in the clinic? Well, much effort is being done already, but the real positive examples of success are not very, very numerous so far. So these are definitely new developments in sciences and technologies, and they will shape the medicine and the healthcare provision in the years to come, and very considerably. You see the long list of them, and nanoscience and nano technologies, they are just part of this broader, very broad, in fact, effort, and very broad and very strong and highly costly also enterprise of the mankind of our times. This is something almost revolutionary that is taking place in our days. And it has already been said many times what are the hopes that what will be brought by all these developments. And also there are some changes that we could expect. You probably don't see the bottom of the slide, yeah, don't you? So I apologize for that. And of course, all these complex factual issues are bringing on the table or under the table or sometimes behind the scenes also these questions of, are these particular technologies doing really good? Are they providing benefit, real benefit? And are they really free of risks? Aren't they doing harm? And are we already in a position that we know enough of them about their safety to be able to go to the clinics? I listened this morning to one bright, really wonderful lecture, and but the professor said that, well, we should almost avoid the trials in animals, and we should go as soon as possible to human beings. So this is something, well, that puts some questions, at least to my heart and to my brain. And I think we are confronted with ethical challenges that are both old and were with us all the time as we lived through the mankind's history. But there are also some new challenges, or these old questions are just asked or to be asked in the new situations, in the new settings. And you see that they could be asked in a multiple setting. So first of all, the questions towards the medical procedure, the care procedure, or the drug or diagnostic tool itself, about the questions about the efficacy. This could be the principle of beneficence in ethical terms question. Is it really beneficial? Then the safety, this is non-maleficence principle. Yes, isn't it doing more harm than good? And then also economical questions. Would it be affordable, and who will be paid for it? Would it not made the abyss between the rich and the poor even greater? And many such questions. In this session, we are more or less focusing on the particular patient, on the patient that is ill and is waiting for the new therapies as soon as possible. And this is his or her own and only life. And he or she cannot wait 100 years so far, because it's just impossible. He or she wants to be treated now and helped now. And so there is also a very strong vulnerability in this. So patient that is in a desperate or very difficult situation could be vulnerable and could take any hype as the truth. And I think the patient should be also protected here against being manipulated into the too risky procedures or too risky trials or poorly defined circumstances. Well, we as physicians, we are bound with Hippocratic oaths and with our medical ethical training, but we could also get biased by some scientific, push that is behind our back, or even with some human greed to be successful, to have more money, to have more publications, to win the prizes and so on, to go to conferences. So we are also vulnerable to some point as a human beings, but the really vulnerable person, the really vulnerable party here is really the patient. And you see that there are many aspects that we should have on mind when we are considering the individual patient. This is the respect for him or her as a patient, as a person. And you see many other things. You see here the classical ethical principles that should be somehow taken into consideration. And I have no time. I think this should be a whole session. I mean, not just one, but maybe one day on ethical aspects of all these issues. Then there is also the society, and even today we should think a little bit also about it, and not a little bit, but considerably and in depth about the future generation, because some of these nanoparticles and some of these nanostructures are not very much biodegradable and so on and so forth, and we do not know yet enough about their fate in the environment, in the human body and so on. So there is a lot of uncertainty, and it is much more, I think, is that we do not know than that we really do know. So there we are in a risky situation, but I would not like to overdo this, because the life in itself, by definition, is a risky enterprise, and it is a very deadly enterprise, because in the end we all will be dead. But you probably understand what I mean here. So this is one of my favorite pictures, and the text that you do not see at the bottom of the slide says this is the situation when the mankind is confronted with new technologies. Yes, you see the mankind that is really crazy a little bit and scared, and the new technology for this guy is this. And why is ethics here, and why is ethics very important? This is just a metaphor. This is just to help this guy not to get harmed by this new technology, to learn how to use it, how to run well on these rolling boots. And this is a very nice metaphor, but well, it could be a whole symposium about that. I think even the goals of medicine are becoming a little bit blurred, and they are becoming constructed anew. And again, what you do not see, because it is in the bottom of the slide, this is the goals of medicine in future probably will be a little bit different. And these are questions like human enhancement, medicalization of happy life, prolongation of life, immortality, eternal youth, and all these wonderful questions. And it is good that we are speaking more and more about responsible medicine in many, many aspects, but the responsibility is not only towards the patient, his relatives, friends, but also to other stakeholders. Even the environment nowadays is becoming a stakeholder in certain sense. And I am not allowed to do too much speaking here because of the constraint of times. Now I would like also to point out a little bit that we have a very much a new kind of patient nowadays, because he or she has much greater expectations. He or she could be much more ill or handicapped. He or she could be much better informed, but also much more disinformed or misinformed. He or she could be more competent and independent, but on the other hand could be much more dependent on Dr. Google and other academics today. He or she should be seen as a partner, and you have here the ethical principles of this, and the informed consent problem. And the informed consent is a very tricky concept. This is a very basic prerequisite for any involvement of the patient in clinical trial or therapy and innovative therapy. But well, I just came from Madrid. There was the Clinical Pharmacology Congress, and there was a special part devoted to the issues of ethics of clinical trials, and especially the informed consent problem is not solved. It's very complex. It's culture specific. It's even religious specific and gender specific, and there are many other issues. So how could we get a really informed and really free and really voluntary consent of the patient to be involved and to take part in the really something new that is going on? Well, understanding of the science and new technology, sometimes it's a lot of mess. It has been already said that even the experts are losing the whole picture in the field sometimes. And what a poor patient, yes, how he or she could understand that. There are a lot of fears and hypes and conspiracy theorists out there. Mr. Virapen and others, yes, are not very helpful in sustaining the necessary trust and the mutual trust that we doctors are not going to exploit you patients just for our greed, and vice versa. So the trust is very important, but it's very easily broken, and it's terribly difficult to bring it back. Well, the costs and these technologies will be not very cheap, so maybe we will be having the expensive care units, but who will be allowed to pass in as a patient? Only the rich or everyone? And what would be the quality, and how would the healthcare system really cope with all these difficulties? And also the justice. Yes, this is a nice joke. And well, this patient is a little bit jealous because this is a huge machine here, but it is not, not to do any good to his own medical problems. So the justice, and especially if you go to politics, you are becoming to enter very crazy field here, but there are regulators and there are laws and there are there are principles that to be this is not very nice in fact picture, because the doctor has blue eye already, you see, and this is the Dr. Google story, internet downloads. I am sorry, doctor, but again I have to disagree, says the woman. And we see more and more these patients. I am very happy that the patients are better informed and more clever, and they are thinking that they are not taking everything what we tell them, but they are many times prey of internet resources of very, very, very bad quality on sometimes the alternative medicine, homeopathy, and many other stupidities are taking their imagination very strongly. So, but we have the new patient that already understands his or her role much better, and is really and could be and should be as taken as a partner in the informed decision-making process, up till to the health policies or politics. Well, just one more metaphor about the personalized treatment. And there are many other nice metaphors, but when you are ill, usually you are not going to the machine to be saved. You still a little bit prefer to go to the fellow human being. And this is also the other part of personalized medicine, the medicine that goes from person to person. I am afraid that the modern technologies sometimes are making an abyss between the persons, between the physician and the patient. So they are like dehumanizing the relationships and how the medicine is really practiced and used. There are some conclusions, but I think I am not going to go through all of them. Only I want to show you my capital. This is the blue Danube down there, and our cathedral and our castle in Bratislava. Thank you very much for your attention.
Perhaps have the general lights, because we are not